Dear Honorable Minister, representatives of government agencies, representatives of international organizations, as well as experts working in the domain of social protection, dear clients and friends, welcome to the webinar on smart targeting in social protection programs organized by Synergy International Systems. Synergy is a company working in government digitalization with systems implemented in more than 80 countries in the domains of e-justice, social protection, public finance management, and monitoring and evaluation. We usually organize similar events to make sure we tell the stories of successful or ongoing or already executed digitalization initiatives so other countries undergoing similar scenarios can learn and drive those projects even better. My name is Lilit Gasparyan. I am a Senior Business Development Executive at Synergy, and I'm going to be today's moderator. Firstly, we hope that those joining from regions impacted by Hurricane Melissa are well and safe. We have both clients and partners from those countries, so we truly hope that you are well and now things are under control. Today, we are honored to have our speaker, Honorable Minister Dr. Vindhya Persaud, Minister of Human Services and Social Security of Guyana. We also have our great expert, Lilit Gasparyan, leading different similar digitalization initiatives at Synergy, the program director of Synergy Auxilium. What we're going to present today is very relevant to the current reality, especially in the context of social protection, as there are always external factors that cause changes, and most of the time they are negative factors. And the organizations involved in social assistance delivery need to adapt quickly and be as agile as possible. During this session, during this upcoming 55 minutes or 1 hour, Honorary Minister Dr. Vindhya Persaud will share how Guyana is positioning itself as a leader in that area, how this vision connects to the government's wider digital transformation strategy, and why social protection was chosen as a priority area. Later on, Lilit Gasparyan will discuss her team's experience implementing Auxilium across multiple countries and helping governments digitize social assistance programs. She will explore how technology and data can make social protection systems not only more efficient, but also more adaptive to changing realities on the ground. Let's start with our first question to the Honorable Minister. Honorable Minister, thank you very much for finding time to join this session. We are very privileged to have you here with us and hear your ideas. We know that you are working on multiple fronts at the ministry, and activities undertaken by the ministry are vast in their nature, and all of them have a very high priority. So my first question is the following. Guyana is positioning itself as a pioneer in digitalization, especially through your ministry. Could you share how this vision connects to the government's wider digital transformation strategy and why social protection was chosen as a leading area? Honorable Minister.
Thank you, Sergey, and thank you for having me on today's webinar. It is a pleasure to join you and the team to speak on the work that is happening that is seriously transformational in Guyana using digital technology and creating a whole arena of digitalization across the country. I want to join with you in expressing my prayers and thoughts with those who are also experiencing the effects and impact of Hurricane Melissa, and people generally across the country who are in crises, who are affected by the blast, like in India, and so many other ways. Our world has so many global crises, and as you know, our hearts, the people of Guyana, His Excellency, our hearts and our prayers with all of them. Digital transformation has been on the front burner of the government of Guyana. And this effort has been led by His Excellency. Just yesterday, he spoke about the will to transform Guyana's way in which we transact everything using digitalization. and taking digitalization into every aspect of the service industry. And that focuses right on social protection. As you know, this ministry deals with the most vulnerable populations. It is imperative that our services are accessible and inclusive. And so working with the team from Synergy and working generally within the construct of what the ministry has to provide, it is speaking to ensuring that no matter where people are, and you have visited Guyana, but you haven't seen the vastness of Guyana, the terrain is quite challenging. It is ensuring that everyone has access to services that we offer. And so when we think of the beneficiaries that we serve, the seniors, for example, the ministry is directly responsible for ensuring everyone accesses their pension, their old age pension or senior citizens pension when they attain the age of 65 years. This, by and large, was a system that involved a lot of paperwork. What we are doing right now is removing the paper from the system to make it a paperless system and to decentralize the system digitally so that our efficiency will increase, our effectiveness as a ministry will increase. We remove the bureaucracy, the frustration, and the hassles that people experience when they're trying to access their pension. And as such, we're not only able to get to them quickly, but we're able to collect data, store data, analyze data, and use it to drive policy and programs so that they are more efficacious. In addition to the seniors that I spoke of, we also work with persons living with disabilities. We work with vulnerable populations where they have to access from us assistance. In the same way as we tackle pension, we're looking at transforming how we store data on a single platform, and we are moving our user interface upwards. Whereas we were only able to have 21 persons use the system, now we have ramped that up to 800 users. That's a significant jump because now it allows us to concurrently utilize all the modules, utilize several platforms, and ensure that when applications come in, they're processed immediately. So in choosing social protection, it is our government's interest in the vulnerable population, directly serving the most vulnerable population, building public trust, creating the kind of platform where people can directly engage with us and where we can have access to their feedback so that we can continue to improve the quality of care. It also overall strengthens our infrastructure with the bigger vision of not only keeping it in that small area of data collection, data processing, data analysis, and serving that population, but having wider integration into the entire service area of the ministry, and then further than the ministry, overall integrating the services across agencies, across governments. So we have a more holistic way in which we serve not only a single person, but families, and then, of course, communities.
Speaking of Guyana, of course, I know it's a beautiful country with very interesting ethnic backgrounds, although it were my colleagues, Haik and Leah, who traveled there and have met you in person as well, and they told me a lot of interesting stories. But coming back to the main topic and the idea that you have just mentioned, especially regarding the inclusivity, what principles guided the ministry to ensure inclusivity and accessibility in those digital services? Also taking into account the diverse terrain, because it's not only the capital, it's also the other regions as well, and the specific needs of indigenous and, as you have mentioned, senior populations as well.
Thank you. So we're looking at accessibility and inclusivity. The terrain is very different and could be quite challenging. As it is right now, we have persons who serve these vast areas of the hinterland in remote and rural communities. They may have to use several boats to get there. They would have to drive for hours. And we are looking at making that simpler, not only for the service providers, which would be the social workers and officers from the ministry, but simpler for those whom we serve. So it is ensuring that we take our services as close as possible to the communities, ensuring that no one is left behind. And they do not find themselves disenfranchised from our service merely because where they are. And so in that vein, we're looking at having an offline model of this. So when our teams go out, they're able to collect information, they're able to even fill applications so that that data could now be channeled into a central server and processed ahead of time when they get back to connectivity. This shortens the process significantly because what would take months or weeks would now be shortened to days. And I think that is a quantum leap. It also speaks to a deeper sense of engagement. One, that we have to ensure that all the persons who are delivering our services, they are trained, because this is now putting technology in the hands of service providers so that every officer, every person who goes out to offer the service, they're equipped with a tablet. They have a special software. They have all of the data sets that we require. So as we gather data when we go out, we're also not only looking at the specific service, we're looking at what other services they need and we can provide seamlessly. It might be going to a home and collecting the information from a pensioner, and then you realize that person needs a wheelchair, but that data is captured and that person has already gone into that remote, rural, or hinterland community. That is now transmitted to us. We can analyze that. And so it moves the ministry from not only being reactive, but being responsive and preemptive. And I think that in itself is significant. It also reduces the cost in terms of us having to go over and over the loss of paperwork and all the other things that can impact and impede on us delivering efficiently and effectively. So Guyana's terrain allows service, yes, but the digital footprint and the digital connectivity that we are trying to create with programs like these, the beneficiary management system that we're trying to create, the social services system that we're trying to create, we are really having a holistic picture of what we need to do as not only the ministry, but the government. So then the next step would obviously be sharing information and data with sister agencies so that we comprehensively serve communities.
Thank you very much, Honorable Minister. It's very interesting to hear the reality and the steps that are being undertaken from you rather than different experts who are working in this industry, because you know the whole situation holistically. I think this is the right moment to ask our colleagues to show us one of the examples of the current digitalization that we're working on with the MHSS and Synergy. I would ask our colleague Rebecca Geer, the System Development Coordinator at the Ministry, and also the Project Manager from Synergy, Haik Vartanyan, to join us. And they will provide a very short overview of the current system that jointly we are working on.
Thank you very much, Sergey. And yes, I'll see that Rebecca is sharing her screen already. All right, so we'll be conducting this short demonstration of our web-based system on the test environment that obviously the data will be used only for demonstration purposes. All right, so as you see, there are different modules in the system. So this is the Guyana Beneficiary Registry and Document Management System, and this unifies all departments of the Ministry of Human Services and Social Security. We'll start from the registration of the household, which is the first step of onboarding a potential client into the system, right? So we start capturing the general information about the first client or the first member of the household. But before that, we capture some general information about the household itself. So under the general information, we usually capture the address, some general information about the household amenities, and so on. So while Rebecca is capturing that, let me also mention that, as you see, the systems that are developed at Synergy, they're based on Auxilium core, and all of our systems are permission-based and based on the roles of the users. On the left side, you see the navigation pane, and there are different departments listed down. The permissions are configured based on RBAC policies, and each user, when they log into the system, they only have access to the modules that they are preliminary provided the permission by the administrators of the system. So here I see that Rebecca is already capturing the personal information about the first member of the household. The standard scenario is selecting the first member as the head of the household. And for this particular example, we'll register 2 members. The first member would be the head of the household, and we'll register another member of the household, which can potentially be either another beneficiary or a proxy of the application. The beauty of such structure is that we only capture the information about the members and the household itself just once. And it's just a matter of maintenance of this data in the future. So the data stays there in the system and serves as a centralized social registry. And after that, we just have to specify which application should be created and use the already existing information and link it to the applications, right? So we can create the childcare applications, public assistance, old age pensions, and any other applications and programs. All right, I see Rebecca. All right, so we've created the first member of our household, and now we'll create the second member. So while Rebecca is registering the second member, let me also mention that aside of the standard scenario of delivering a payment or a benefit to the applicants, we also support workshops and the trainings. And another beauty of unified management information systems is the referral and queries module. So the social work, the workers, the employees of different departments are able to refer a client from one department to another internally by using the system features, and the referral and query module serves as a great tool for this activity. And of course, we have the payments module. So once the information about the household and the application is captured and the application is processed and approved, eventually all approved applications will go into the pay sheet. And this is where the distribution and the life cycle of the payment will start. And depending on the countries and their basically processes and policies, it varies, but our system is flexible and capable enough to integrate and support all of these features. Now, as you see under the members, we already captured some income information, and we can see the aggregated data under the household income tab. There are other tabs available as well, like the assessment and others. So we can use the assessment tab, and Lilit will touch this part in more details during her speech. And I believe we're good to try to save our household as a draft in the system and use this information to link an application to our existing household. All right, so the household is registered, it's there. We're moving to our next module, which is the applications. Those are the actual records which are registered. So this module is used to register the actual applications of potential clients. As you see, there are different types of applications. So Rebecca will randomly pick one of the existing applications. All right, so public assistance and economical. So when we create the application, the respective form will pop up. And this is the digitized version of the public assistance economical application. And with just a few clicks, we'll be able to fill in the information about the application, and and we'll basically link the household that we've registered to our application. So we can use different criteria to search and find our household. We can use the household ID or the name of the beneficiary or proxy, All right, so we see that the client is there. So we just select the client and link them to our existing application. So once this application is saved, it'll be stored and it will be linked to the household. So in a similar way, any other application that is registered and linked to this household will appear under the household, will appear in the household itself, and it will serve as a one-stop shop for any social worker to open the household and have a view of all existing applications linked to this household. All right, so the application is registered as well. Well, I'll just quickly show that it appeared under the household. Yeah. Rebecca, if you can open the test household that we created. Perfect. Okay, and under the household overview, you see that the number of applications is 1. We even see the state of the application, and any other application created and linked to this household will appear under the household overview. In a similar way, any referral, any workshop, or any case file created and linked to one of the members of this household will appear under the household overview. Perfect. All right, so I believe we were only left with the reporting. So the BRDMS and the systems which are based in the Auxilium core, they have very ad hoc reporting module. So the data captured and stored in our systems is available in the reporting, and you see that we have different types of reports such as pie charts, tables, lists, and other types. So for example, we've created some test reports here. You can see the number of beneficiaries per month. We're able to generate reports by the regions and other territories of the country. And this way to visualize for upper management and use it for reporting purposes. You see another pie chart report created by the gender of the beneficiaries. We can even see some total numbers per number of senior citizens for certain types of applications and so on. And the upper filter allows us to filter the entire page for the report, not only one report, and see filtered data. Sergey, this is it for the BRDMS system. Thank you.
Perfect, fantastic. Thank you very much, dear Rebecca. Thank you very much, dear Heike, for showing us the result that this collaboration has achieved so far. I know that you internally are still working on different areas of the system, which hopefully would be used even more and more. Although we have prepared many more questions to the Honorable Minister, now briefly I want to ask a question to our other speaker, Lilit, and then we will come back to one final question to Honorable Minister. Lilit, in Synergy, you have been delivering Synergy Auxilium, the system used to digitalize social assistance program management in different countries, in Guyana, St. Vincent and the Grenadines, Haiti, Barbados, Bahamas, Trinidad and Tobago, Zimbabwe, and many, many others. In reality, from your perspective, how can the technology and also its interconnection with the right data make social protection systems not only efficient, but also adaptive, to be able to respond to changing realities that are happening on the ground? Lilit?
Thank you, Sergey, and thank you, Honorable Minister, for sharing the experience. I'm sure our community is appreciating a lot to be able to learn from the Guyana's experience. So indeed, we have been delivering Auxilium to a number of countries, to a number of ministries, and social protection digitization is never an easy process. I mean, it does not happen overnight. It is a long process and normally includes a number of phases. The first phase is normally centered around having the data digitally available, right? Around the registries. whether it is having an access to a social registry, to an integrated beneficiary registry, or just a database of existing or potential beneficiaries. So once we have the data in place, and that's the most difficult part because it requires cleaning the data from different data sets, making sure that it is verified, and there are hard to get areas where social workers need to meet the people, to gather the data using flying tools, etc., as it was mentioned by the minister. And of course, it must be constantly updated. But once it is there, it's like a gold mine because now we need to think how we can turn that data into action. So I will now share my screen because internally we are constantly working on the Auxilium solution. And recently we have been working on a module on smart targeting, meaning how can the programs using the available data make sure that they are responding to the emerging needs of the vulnerable population. So we said that Auxilium has the part of the registry, and this is where Rebecca demonstrated how to enter a record in the registry. Before I continue, just a quick disclaimer. What I am displaying right now, this is a demo system with test data. So it in no way reflects any of the real situation. This is just solely for the purpose of this exercise. So apart from the registry, Auxilium includes integrated program management part. This is already where social programs using the data from the registries, so they can use it for their targeting, enrollment, assessment, such as creating the applications, right? And also the actual assistance provision cycle, such as generating pay sheets or distributing goods or services. So right now I am in the registry module. I will not go into details, just to open one of the records. So you could see that really the household record represents like a one-stop shop view of what happens within a certain household. All of the applications, referrals, assessments, workshops, etc. So it really allows for good case management to make sure that the household is or the family is uplifted. So the data can be captured at different levels. So the household level, individual data, and so different data points can be collected, and information, socioeconomic information, health-related information, education, income-related information. Now, all this data is used to be able to perform the assessment. Depending on how every single institution, what kind of methodology they have for calculating PMT score, vulnerability priority or vulnerability levels. So each institution can define their own criteria, like for example, household with multiple disabled or chronically ill persons, right? Household with teen mother. So for each criteria, this is linked to a certain data point that we are collecting for the family, for the household. And now the system is going to automatically identify if this condition is met or not. So we can see here that this is automatic assessment. I can quickly check the settings part. So just to show you how this is done, basically we incorporate PMT scoring, where each criteria is given. Based on that, depending on which range it is, we can define the vulnerability level, if it is extremely vulnerable, highly vulnerable, etc. Now, the new thing is that now this can be calculated on a large amount of data. So when we have our data already digitized, either through interoperability, connecting to different registries, verifying the data, or maybe synchronizing all of the data that is collected offline during different tools, this scoring can run on a large amount of data, eventually allowing us to prioritize our registry so that we can see which population is falls under which vulnerability range, right? Let me also open one of the dashboards using the same tools. I have created a test dashboard that is based on this household data set, and it uses the scoring for its analysis. So again, the dashboard can be like on a high level for the whole country, or I can drill down to certain regions. So for example, it can show me that the highly vulnerable population is mostly female, or I can do an analysis per age group. So to understand that vulnerable population are children and elderly mainly. And I can also do some analysis based on geographic location. Again, the same disclaimer. So this dashboard uses test data, and in no way this represents the real situation. I'm trying to zoom here. Okay, so what I have here, I have a map that is being colored using the PMT score. Basically, it allows me to see where the concentration of the color is higher, means that this is the part where the more vulnerable population lives. So, and especially if this is an area that is prone to shocks, such as floods or droughts. So this will allow a more informed decision making in terms of resource allocation, etc. But this is still about the registry. So we have the data available here. Now, what can programs do? How can they use the data? So we said that we also onboard programs into Auxilium, right? So here I have created a test program. It is called Restore. So cash support for dignity. This is for the purpose of our example. So let's say they provide timely and targeted financial support to individuals facing severe economic hardship. Now, we've taken a look at the overall vulnerability, which is at a country level. This is generic. But we know that a lot of programs are going to use Auxilium, and each programs, they have their own specific eligibility, like what is their target audience. So here we allow defining both, right? So this particular program, they are focusing on single-headed households with dependents, elderly living alone or no income, families affected by disaster, and unemployed or underemployed individuals. So this is their specific eligibility, but we still want to make sure that even within this target audience, we help the most vulnerable population first. So just quickly to check the settings as well for this program. So this is a cash transfer program on a monthly basis with a fixed amount paid directly to the household or the individual. Now let's imagine the scenario that this program has received an amount, so that they provide assistance to, let's say, 1,000 beneficiaries this year. Okay, now how can we target? The purpose of the smart targeting module is for the system to assist in selecting those people who need the assistance first. So like in 2 words, to make sure that the people need the assistance most receive it first. So to do that, I clicked on create applications in bulk. So the system is going automatically to create applications for me. I am selecting my assistance. And so let's say I need 1,000 beneficiaries. Now the system is going, then I need to provide my filters. And this is the thing, because I have the PMT score calculated on my registry, I can use it as a filter. So I select the extremely vulnerable first, and then I am using the assessment criteria already. This is specific to my program. So let's say I want to target at least any of the criteria that would be corresponded. So I'm selecting my eligibility criteria. I can filter by location as well if I want to. And now well, obviously, because this is a test system, so let's say there were 39 records found. Now, as a next step, the system is going to ask for any additional information from me to be entered on the applications. And then it will create the applications for me in the background. Now, I asked for 1,000 applications, 1,000 people actually, but there were less available. As a next step, what am I going to do? I'm going to lower the vulnerability level. So just as an example, so the same program. Now I'm going for the high vulnerable population using the same criteria. I will not repeat the process right now, but just to give you an understanding that we're going to target by having the vulnerability priority in mind. So now I'm just going to open one of the applications that were just created. So this is the application. I'm going to view it. So the system automatically linked a household to it. It selected the beneficiary for me. And this is the assessment of already my program criteria. So these two would correspond. So now, depending on my business processes, right? Because Auxilium also digitizes the business processes of each programs. I may move the applications through the assessment process, such as submit to the regional supervisor, for example, for the assessment. And, for example, approved by the region. Basically, that's it. This is how we can use the existing data to make sure that we target more efficiently and smarter.
Lilit, thank you for presenting this module, and hopefully it would be used in different countries to make sure that reaction of the program is quicker overall. I want to ask another question to the Honorable Minister. Of course, we spoke about the current progress. We had a chance to see, thanks to Rebecca and Heike, the current version of the system. But I believe not everything was very smooth, and maybe internally and externally across the agencies there were some challenges, and many of the challenges were addressed, but maybe some challenges are still there. And Honorable Minister, it would be very interesting to hear your perspective on those internal and external challenges and how you are addressing them, on what would be required to have less challenges moving forward. Honorable Minister.
Thank you. Now, I want to acknowledge the work that has been done by both teams, both in Guyana and through Synergy, because when we speak of challenges, it would have come down to the teams and the work that they would have had to do before we got to the point where Lilith can actually present a program that shows the magnitude of reporting that we can have, where we are able to have the vulnerability index, where we are able to understand what are the needs comprehensively of vulnerable populations, all the way down to granular levels where we're looking at individuals and families in addition to communities, and where we are able to capture holistically the country and all the needs and the peculiarities of various communities. And what she just presented would have required, one, knowledge of what we wanted to achieve as a ministry, as a government. And so this program is not only limited to our pensioners or people living with disabilities and those who seek public assistance. It's looking at other categories of persons, children, persons who experience gender-based violence, the agencies that deal with women's empowerment, like the Guyana Women's Leadership Institute. So to get all of that to happen, data collection was the most important thing, to understand what we wanted to collect, how we wanted to have that data, and to ensure that the data was in a ready state, where it was cleansed, where it was available in the first place, because a lot of the data has not been digitalized for years. So we were transferring that from a lot of paper, or we were using some earlier digital systems to convert it to what we want to do to have that level of reporting so that our responsiveness would be better, it would be more efficient. And we were looking at combating digital exclusion. At the same time as we are collecting data, we want to make sure that no community is excluded, one. So that was challenging to get the kind of data we needed to populate the system. Two, we needed to train persons. That was also challenging because it was trying to get everyone at the same level to use the software, to understand the software, to buy into the vision, to understand how the integrated software would work. So it was coming down to a concept of getting people to see work smarter, work more efficiently, and how every department, every unit of the ministry could use data to drive policy, to drive budgeting, more gender responsive budgeting, for example, to drive programming. So that required working with the teams to have that understanding. That was the internal aspect of things. Then looking beyond the central point of the ministry, going out into the regions and replicating the same things. Here again, training, vision, buy-in, ensuring that you have that holistic approach and people understood the need for collaboration. So it was changing the culture from how we did work before with an analog type process or a paper type process to this highly digitized model that we wanted to go with. I think that would have been very challenging. And it is also finding the key specialists to work on these things, because it's not just all the users, it's the persons behind the scenes, like Rebecca and the whole team, dealing with all of this technology, using their skills and how they were able to work with your team to jump and to understand and to learn quickly. Because what was very good about this whole experience was the time frame in which we did it. It was not a long time. It was just about over a year, and it required your team to come. It required some visits to other parts of the region to see how other models work. So we didn't reinvent, but we learned. So there were a lot of lessons to be taken from that. But it was trying to create equity in what we were doing in this whole model, because we don't want to develop a model one and then we have to redo the entire process in 5 or 10 years. It's being progressive in our approach and our outlook and planning for 20, 30 years, understanding the evolving needs of the target populations that we're dealing with and how we can use that bigger vision of integration to pilot what we or navigate where we wanted to go. And those were the issues we were looking at. It was looking also at how we can potentially look at 200 plus services that government wants to provide to its citizens using digital platforms. So it's really having that bigger picture vision and having the buy-in of everyone who has to use it, because we can have the best digital models in the world, and that's where Guyana is heading. We're also building our capacity here as a country. So it's prepping people that you would have worked with to understand, look, when this is done, you have to take ownership of this. You have to develop it further. You have to build on it. So it's really this quantum leap. And that in itself is not an easy thing, because it's changing behavioral, cultural patterns of how we do transactions. So I think those were some of the challenges. And the other part of things, like we are moving to electronic payments, more electronic payments, for example. And how do we get an 80-year-old pensioner to want to put or access her pension or his pension from the bank? So the platform we have stopped being only about data, but being operational to provide the pathway to electronic payments, so that electronic payments don't just happen, they're used and they're done in a very quick way, so that there is reliability in the system. At the end of the day, when we do these kinds of things, we want to build public trust. We want people to use these systems. We want them to be confident that their systems will work for them in a timely way, and they're simple. So the interfaces have to be built both internally and for public. So if I say it this way, it's a lot of moving pieces. So coordinating the moving pieces could be a challenge, but I want to again thank the entire team for, moving us to this point in time. Thank you, Sergey.
Thank you very much, Honorable Minister. Dear participants, we already have some questions in the Q&A section of the meeting room, which is great. Do some vulnerable beneficiaries face difficulty in providing identification documents, especially for example, the national identification number, and how can this be overcome? And later on, if we would have time, how those beneficiaries are served in difficult and remote areas where there are no telecommunications or banking services. So offline module is helping with data collection, but what about the actual provision of those services?
So that would speak to me directly in the sense that, yes, we do have some challenges with national identification. Sometimes the IDs may be lost. Sometimes the persons provide incorrect IDs, and that would affect the delivery of service because a lot of the system revolves around the national ID in terms of finding you on the system to access your service, to provide your service, and to utilize the ID for transactional things. Like if you wanted to use the bank, if you have an incorrect ID, you might affect the way in which your service is provided. So it is going back. It is now getting the human factor involved and looking at those persons and working with governments, larger machinery to ensure that they have their source documents. It's working with perhaps senior people or people who have some difficulty in a very personal way to say, you know what, you gave us an incorrect ID. What's the correct ID? And we do that every day. And it's also not, while we do a lot of things digitally, it's not excluding the human element of things. And while we have the offline support, it still requires our officers to make those long, arduous journeys into very remote communities, which will not stop because we do direct payments. That's a service we provide and will continue to provide where people don't have to come out very far. We go to them in their communities. And then, of course, we do the shut-in delivery services for people who are unable to come out of their homes. So while we are doing all of this and we are capturing a significant percentage of our beneficiaries, we are not going to exclude the human element, the human factor, and getting out to those people who need help.
If I may also elaborate on this just from the
Absolutely.
perspective
Yes.
of other countries, because indeed not having a national ID, even not losing it, but not having it completely is a very common practice, right? And you cannot exclude those people because they are mostly the ones who need the assistance most, right? So what do the donors or programs do? Some may provide an ID card for their beneficiaries. Let's say if they have certain beneficiaries and they do cash transfer assistance, etc. So they would provide some cards for that. And another way, but of course this needs some work to be done to be able to have like a biometric registry, to be able to biometrically identify, like using fingerprints or other, and then to verify that data. So to avoid some of the maybe double tipping or again inclusion or exclusion problems.
So Guyana is working on EID. This process is being led by His Excellency, and it's going to ensure that every person, every citizen who lives here, they have a unique ID that will be used across agencies and for many services. So that will also help this issue of if someone loses their national ID or they don't have a source document. But while I say this, concurrently, there is registration happening across Guyana and there are teams going out into remote rural communities to ensure that people have their source documents. If you just permit me 30 seconds, I'll tell you this. When I came in as minister, the numbers that we had then those numbers were a direct reflection of the fact that many people in the indigenous hinterland community, rural remote communities didn't have their source documents. But if you look at the numbers like tripling and doubling for beneficiaries, a lot of that has to do with more people having their source documents as well. And that is direct work from the government to ensure that nobody is left behind.
Perfect. Thank you very much, Honorable Minister. And now we will have the last question for now, which is the following, and I think Lilit would be able to respond to that. And dear participants, you can still add your questions and we will respond to those questions separately as well. Lilit, the question is this: can you please clarify what smart targeting specifically refers to? What aspect of the targeting approach or implementation counts as smart, and what are the linkages between the registry and other government databases?
Sure. So for us, the definition of the smart targeting is that you do not only take into account the target audience for your program. For example, the program targets people with disabilities. Okay, we know that that's their target audience. But now, because the people, the vulnerable population in the social registries, they live in different conditions. There are people who are more vulnerable than the others. So here, if there is a proxy means testing available, and it is possible to determine overall vulnerability priority for a country, then the programs can target smarter by also focusing on the overall vulnerability and not just their specific eligibility. So I hope that answers the question. The other was about interoperability, if I got you right, Sergey.
With the registry.
So it not necessarily that data is readily available for a certain institution, right? Auxilium allows integrating with the REST APIs to other third-party systems. Let's say there is a registry in place, or to verify data with other civil registries, for example. So provided that there are data sharing agreements in place, it's possible to get the data from other sources and again use it for the targeting purposes.
Perfect. Thank you very much, Lilit. Thank you very much, dear Honorable Minister, for joining this session today. Dear participants, we're going to end the session right now. Before we do that, I want to inform you that we're going to send this recording to all the participants. It's going to be shared on different online platforms. So let's officially end the webinar at the moment. And I want to thank all the representatives of governments, representatives of large international organizations and experts engaged in the provision of social assistance to different vulnerable groups for joining this session. I want to separately thank Honorable Minister for joining us today, and I think your presence and the insights that you have shared are going to help and boost those activities, not only in Guyana, but also in other countries, especially in the region. So, dear participants, in case you are interested in the overall solutions that Synergy is providing, you can reach out to us and we will indicate the right information to you, and our colleagues will help you with whatever is possible. I want to thank everyone for spending this 1 hour, precisely 1 hour, on us speaking about digitalization in the domain of social protection and specifically smart targeting. We had a chance to hear what the government of Guyana is doing for the last years and where overall their digitalization vision is going, especially in the context of social protection. So I wish everyone a fantastic end of the day, productive week ahead, and overall effective end of 2025. Everyone stay safe, be well, and goodbye.